Good afternoon, and welcome to today's program titled Transforming Healthcare Data into Actionable Intelligence. My name is Mark Haglund. I'm Editor-in-Chief of Healthcare Informatics Magazine. Today's program is sponsored by StarLimbs. Thank you very much to our sponsor, and to you and our audience for giving us your time and attention. Before we get started, I'd like to share a few housekeeping details with you. Each window on your screen can be moved by clicking and dragging, or enlarged and minimized by clicking the icons in the top right corner of each window. Please use the Q&A area to the right of the slides to submit a question at any time. If you cannot see this area, simply click the red Q&A button. To download a copy of today's slides or other materials related to today's topic, please use the resources list located in the upper right of your screen. If you have any technical issues during the program, please click the yellow Help button to troubleshoot the issue. At this time, it is my pleasure to introduce our speaker, Jim B. Ray, Principal for Aspen Advisors. Jim has been an advisor to healthcare and IT executives for over 20 years. With a background in application design and data warehousing, he's worked with clients to define business intelligence strategies, implement data governance, and develop roadmaps for leveraging data for ACO and population health initiatives. Thank you so much, Jim, for taking the time to speak with us today. And with that, the audience is yours.
Thank you, Mark. It's my pleasure to talk to you today. As you've heard, I'm Jim B. Ray. I'm principal with Aspen Advisors. I'll head off the inevitable first question, and that is the last name is actually Balabushko Ray. Jim Ray met and married Pam Balabushko many years ago, and somehow I only took the B in my name. It's complex, and you can ask her if you'd like more details about that. I've been doing IT consulting for about 20 years, and the last 12 of them have been in healthcare. Prior to getting in healthcare, I did hang my shingle doing BI and data warehousing solutions for healthcare and travel and staffing services and telecom and insurance. I'm a rabid Kimballite, although I respect the Inman people. And in the last 18 months, I've done 14 BI strategy and architecture, ACO, and population health projects. If you're curious about Aspen Advisors, I'd recommend you visit our website at www.aspenadvisors.net. You'll find that at the end. Just a few facts before we get into the meat of the presentation. We were founded in 2006. We have over 100 associates. We have over 100 clients, and we're proud to have 100% referenceable clients. We focus on strategic and advisory services, and we have strong class ratings if you'd like to take a look at those as well. Now to the meat of what we're talking about today. You already saw an overview of what I was planning on talking about in the presentation overview that you clicked on to get to this. I want to just make sure to get it down into bullet points. What I'll be addressing today is the expanded role of analytics in healthcare, a framework for transforming your organization organized by the old leadership mantra of mindset, skill set, and tool set. I'm going to tell you a bit about how to structure a project to assess your organizational analytic maturity. I'm going to talk about how to structure data governance for success, and then I'd like to finish up with some ways to assess the current landscape of analytics vendors. So getting into the overview of why we're doing this, it's all driven by the triple aim. The way to transform healthcare is to realign competition with value for patients. And what we're trying to do is make sure that we are addressing population health, the care experience, reducing per capita cost. We want to get better care access, coordination, and communication, high-quality delivery. We want better population outcomes. We want to reduce per capita cost of care. We want less need for healthcare resources. And we want to have a patient-centric focus for more self-care and wellness responsibilities. The way we get there is with analytics. And this shows the picture that analytics has really expanded quite a bit. I'd say that if we were talking 5 years ago, it would have been a lot more about financial intelligence, about us trying to figure out more about patient cost analysis, service line analysis, procedure cost analysis. This is the world of the EPSI and the TrendStar, the cost accounting systems, revenue cycle analysis, and coding and optimization, and market analysis, going to SG2 for data. But we also are collecting a whole lot more data in our EMRs, and so clinical intelligence is extremely important. Quality outcomes management, population health, wellness and prevention, infection control, variation reduction, and drug utilization reviews. We want to be able to run our operations more efficiently, so we want to look at capacity planning and management. We want to do patient flow management, ED, OR, ambulatory. We want resource utilization and patient scheduling access. There have been entire companies incubated at the Cleveland Clinic that had to do almost entirely with dashboards around those tools. And then we want to bring research into the fold. We don't want to necessarily have that be a corner of the academic medical center anymore where some grad students are running numbers. We like to actually have research be accessible to the larger population. Clinical trials, comparative effectiveness, health economics, drug safety surveillance, disease surveillance, and patient recruitment. And it's not enough to simply be retrospective on this. We need to try to be prospective and predictive as well. So this is a huge bucket, and what I've just talked about is possibly a half dozen different tool sets. And to get there, we need to come up with a comprehensive strategy. We are all coming up with data growth as well, and this is both an opportunity and a challenge. Analyst excellence requires we look beyond your core EMR and your revenue cycle data sets, and we want to incorporate comparative and benchmark data. We want to include data from external partners with claims, as well as external EMRs. We want to try to integrate with device and home health, and we want to start to unlock the information that is in your unstructured notes. And with every new data domain that you start to capture, you have the expanded challenges of availability, quality, trustworthiness, timeliness, integration, access, and security. These are all things you may have already started to address with your existing EMR-based data analytics or your financially based TrendStar. You're already answering these questions, but with each new piece of data you bring in, all these questions have to be asked. To get there, we use the keys to analytic value. And again, I brought this up: mindset, skill set, and tool set. So when we talk about mindsets, what we want to do is address data-driven leadership, enterprise governance, and value realization. When we talk about skill sets, we want to talk about what your analysts are capable of, as well as your physician and patient engagement. And when we talk about tool sets, we want to talk about analytics, which is a presentation and interaction with the data, as well as data management. To achieve these objectives and ensure the goals are being met, we also want to evaluate changes to your governance overall, and that's part of mindset, as well as leadership and making sure that that's being driven forward. Getting into detail, mindsets, data-driven leadership. Transforming healthcare does require that leadership teams commit to using data and analytics to take action. Leaders who provide executive sponsorship to commit business and IT resources, they have to serve as evangelists and promote the use of analytics throughout the organization. So what I'm talking about here is really ensuring that everybody is aligned to the single goal that data means something and that we will actually make decisions in how we treat patients and how we operate our business based on what we find in the data. We want to move beyond the gut feel. Enterprise governance is the second piece. These enterprise governance processes are needed to set priorities and focus attention on analytics. We need to make sure that you have processes in place to decide on what subject areas are focused on, as well as what data means what in the organization. And then finally, a benefits-driven approach. Value capture design processes, and try to create a TCO for each one of your projects. Going to skill sets, we need to start with clinical subject matter expertise. Your analysts need subject matter expertise, analytic training, technical skills. You need to make sure that your people can do this work and they understand the underlying meaning of this data and that they can avoid making false correlations. We need analytic tool training and expertise. We need to make sure that your people can actually use the data, use the tools that you're providing to them to the maximum that they're able to do. It's not enough to have report writing skills. Usually that does help, but you also need to be able to ask the next question and proactively ask the next question and try to look out for false correlations and going down rabbit holes that don't get you anywhere. And then finally, change leadership. Again, this is a skill set that you have to have in your organization, and that is it's not just the leadership commitment to use data to change process, but also the change leadership skills to implement new processes. This is something we're doing at several of our clients. Finally, for tool sets, and I'll be getting into this a lot, quite a bit later in the presentation, we want to make sure that you have the infrastructure and tools to store, analyze, and present the data. So in analytics, you want to make sure you're having statistically relevant queries. You want to have integration of benchmarks. You want to have access to best practice and best proven models. I'll get to this later, but attribution and groupers are some of your big areas of worry. You want to make sure you have user-friendly tools that people actually log in and make sure that they're doing things. But you also want to give them guided data exploration and not allow them to drag things in to create a potential false correlation. And then the other piece is the drudge work, and that's the data management. Making sure you have data dictionaries, metadata catalogs, medical vocabulary cross-reference tables. You need to have security, and this is an area where a lot of BI solutions do fall down, and that is logging access. If you're going to be providing all this patient-centric data, you need to have it treated with the same level of HIPAA control as your electronic medical records itself is. And then finally, performance management to monitor and manage system performance. If your data warehouse isn't loaded until noon the next day, and if it takes 5 minutes to run a query, very good chance that it will not be used all that much. So that's the foundation of how we look at this. So to map a path forward, you need a good idea of where you are actually at. Now, at Aspen, we use a maturity model to assess current state and then map out projects to get us to the higher level of maturity. Now, we use a four-stage assessment criteria. Foundational, that's for starting out. Aspirational, for getting it together. Proficient, for doing it right. And transformed, for living it. Now, this isn't necessarily proprietary for Aspen. I was actually at a private BI vendor summit. We had leaders from 10 different consulting firms there, and we were being very honest with each other, just sort of sharing what we see of the marketplace. And a lot of them are using a similar 4-box matrix, and many rated their clients similarly as well. So I'll show you what we use. And it's our data and analytics maturity model. So, in foundational, you can see a few things along the lines of you have data sitting in spreadsheets. You have departmental data experts. You have conflicting data. In level 2, aspirational, you have things like you may have created an enterprise data warehouse. You may have departmental dashboards. You certainly have developed pockets of excellence, and you may have even started to charter enterprise governance. By the time you're in proficient, you're doing a lot of these things right. Your governance is working. You have enterprise analytics tool sets. You're starting to approach near real-time analytics. And you've got standardized reporting. When you get to transformed, your data-driven leadership is in place. You're getting your data at the point of care, and you're starting to work into predictive analytics. With this next slide, what I want to show you is that we can now map that against our areas of transformation. So going back over what I just said, looking at the mindset area, if you have data-driven leadership, in a foundational world, you would have little or no analytic leadership. Aspirational, it would be departmental champions are in place. In a proficient organization, the executive team is aware and committed to using data. And then in transformed, data-driven decisions are embedded in core processes. In a transformed organization, a leader would never dream of bringing a new system in to the application profile without having a good idea of how that data is going to be used and be integrated with other pieces of information. For enterprise governance, under foundational, we have departmental control. In aspirational, you have pockets of excellence. I already referred to that. In proficient, you have executive team providing oversight, and then in transformed, you have a formal enterprise and analytics governance. And then for value realization, this one's the trickier one. In foundational, it's very informal. You don't know if you're getting your ROI out of your investment in analytics. In aspirational, you start to do this on individual programs, and you can set to monitor value at capture. Some organizations are doing that with value-based purchasing right now. A lot of people are doing that on a MSSP programs. Some of the government programs and ACO programs are excellent at helping you point at value in analytics. And once you move to proficient, clinical and informatics analytics programs are required to set and report on value capture. And then under transformed, again, it's a given. You know what the value is for everything you're doing in your organization. Looking at skill sets, I think you could probably follow the path here. With analysts, it's departmental, and they're spending a whole lot of time assembling their data themselves. In aspirational, the analysts are centralized somewhat, and the focus is on development of departmental level dashboards. Under proficient, enterprise level teams are starting to be aligned. You're starting to design and deploy self-service analytics, and you have islands of predictive analytics. And then, of course, under transformed, predictive analytics are actually integrated into your clinical workflow. Under physician and patient engagement, again, foundational, it's really not there. Aspirational, small programs are in place. There's some patient outreach being driven. So, you may have a couple of registries in place to help you. Under proficient, your analytics programs have executive sponsors. Projects are led by clinical operations and champions. And then under transformed, all analytics programs have an operation champion, and formal communications programs promote the adoption. My final piece to talk on this is under tool sets. Under analytics, you're in Crystal land. You're doing a lot of work in Crystal and Excel. In aspirational, you start to get into pushing dashboards out. Under proficient, you start to dive in and actually do self-exploration. And under transformed, you start getting predictive, and it starts to be integrated directly into your clinical and operational workflows. And under data management, department and application tools, some data integration. Under proficient, baseline, you're integrating it into an enterprise data warehouse with some external data being integrated. And under transformed, you really have a strong set of plumbing to make everything work. So where are the clients in this? I teased at this when I said that we were all talking about this. We all, as an industry of consultants, we all agree that these are benchmarks and we as different firms, we all have different names for how this works. But when we laid it all out, we all felt that our collective user base, which is pretty much almost every hospital in the country at this point, our collective user base is about 45% foundational and about 40% aspirational. That's 85% is under the line. And that is simply that everybody is on this journey together. When we get into proficient, it really felt like only about 10% were really doing analytics in a consistent and well-governed model, and perhaps 5% or even lower were in a transformed. And I think that those are the big names you keep hearing about who is leading in analytics. I don't think that this is a failure. This is an opportunity. This is something for us to all recognize, the fact that a foundational organization is not necessarily a data-starved organization. A foundational organization is a group where the analysts, the departmental people, Chet who works for finance, Dory working over in quality, with their water-cooled spreadsheets that nobody knows exactly how it's being done, but they're delivering the data that the executive leadership needs. That's foundational. They are getting their work done, but it's difficult to replicate it. If any of those people are buying lottery tickets, you're at risk of losing work. So I guess I just present this to show that it's not just this isn't just what Aspen is looking at, and this is a consensus of where the industry is at. So hopefully everybody listening on this call can feel a little bit better about where you are and how we can get you there. So let me get you to how you can start moving forward. Moving up from foundational to aspirational, usually what we've run into is that there is often a trigger event that forces a group out of foundational into aspirational. And that is they realize they have to have some controls. They have had one of their key analysts leave. They have found a key error in an ungoverned database. Something happens, and they realize that they need to do that. That's the negative side. On the positive side, they perhaps may decide to go to an ACO or go at risk for population health, or decide to enter a new service line and do more analytics that way. So to do that in the mindsets area, you have to start out by creating a high-performance team. You need to review your best practice. You need to define the processes that will be used and apply a benefits framework to those baseline metrics. Skill sets, you need to assess those skill sets and start filling in your gaps, training, coaching, and recruiting. You need to recruit for lean, for data-driven decision frameworks, and for physician engagement. And you need to start doing tool-specific training, project management, and facilitation skills. And for tool sets, a lot of times there is a purchase. You will want to buy something to get you up into aspirational. You want to look at getting into a data governance tool set, some metadata management, some data dictionaries. You want to look at getting a data warehouse or a data mart, or perhaps contracting with a vendor to help you build those. And then for analytics, you want to at least get the basics to be moved beyond Excel and beyond Crystal to be able to start presenting data in a more exploratory format. Getting from aspirational to proficient is a bit more difficult. Some of the changes you need in mindset is you need to recognize, and you have to set in rewards for data-savvy leadership. So when people make data-driven decisions, you need to have the executive team willing to promote and compensate linked on success in those areas. In data governance, you need to have access to data and tools based on conformance with the data governance program. And what that means is that you need to have the enterprise data searchable. You need to have the data be, you need to be able to have an easy way for somebody to say, what's my best way of getting average length of stay? What's my best way of determining who my diabetic population is? And not have it be something that you're reinventing, but rather have it be something that the organization has defined, written down, and accessible. In skill sets, it's a case of simply continuing to invest in that skill development. I also believe that you need to be realigning people at that point, that a departmental silo approach simply doesn't work in a proficient organization, that analytics needs to have at least very strong dotted line relationships. And then in tool sets, you want to acquire or extend your existing tools to integrate external data. So you want to start getting master data for physicians, patients, and organizations outside of your own. You want third-party analytics services to support population health and integration of claims. And also your analytics tools need to be selected based on how they will integrate into your workflow. The final piece is really transformed, and what this is the organization just being committed and living analytics. And it's almost a moment where you just go, this is what we're doing. You embed the reward and recognition of analytic mindset in your policies and processes. You build the analytics skills into your job descriptions across the organization, and you continue to invest in tools that focus on near real-time decisions. You actually start to push your analytics and your registry group to start working on best practice alerts and some of the clinical EMR build groups need to actually care more about the enterprise data warehouse and the data that's coming through there. It can be quite challenging. I'm not saying it's all easy here. I didn't say anything it was easy. The way we get people there, and this is something that really any organization can undertake by themselves, is to commit to a 12-week program. And a 12-week program is to create a roadmap and a business case for your own analytics. And what you need to do is you need to take a framework. You need to assess yourself with clear eyes and talk throughout the organization. You can partner with a consultant to help you do this, or you could do it yourself. And we would, a standard project of this line is, a project initiation at weeks 1 and 2. You confirm the project scope. You collected the existing documents, and you start to get your list of people to talk. You do a discovery weeks 2 through 5. You interview leadership. You start to write it all down. You interview IT, and you present current state at the end of that week 5 to say, did we hear everything right, and allow people to react to that. In weeks 5 to 8, you do direction setting. You confirm that, yes, we heard everything, and in the process of collecting this current state, you heard that I wanted things to move this way. You document your futures toolset requirements. You conduct a gap analysis. And most importantly, in 12 weeks, you have 3 major feedback points. You have reviewed current state. You review preliminary feedback for future state, and then you leave yourself 3 or 4 more weeks to let that information refine your vision. You create a roadmap, you create a business case, and you present that roadmap, and then you fire the starter pistol and you get going. It's important to engage users and get that feedback and educate on what's possible. But don't promise a leap from foundational to transformed. It's simply not possible. We believe that you can charter projects that will move you up one solid category in 12 to 18 months, and I think that that's a reasonable thing to do. If you recognize you're in a foundational organization and you want to move into an aspirational organization, give yourself a year and give yourself a set of maybe 6 major projects to get there. And I think, and it is doable. We have worked with clients to do it. We can move you up one good bump. Let me take a moment to talk about governance. Okay, that's the big G. It can be it's very challenging in that there's a lot of literature out there about how to do governance, and we have encountered a number of clients who have built data governance steering committee or data governance groups, and what's unfortunately happened is that these clients have tried their best practice. They charted the group. They've set up the team, and then by 4 meetings in, the team evaporates. They stop meeting. And what happens is that the organization of the group, the membership of the group may not exactly be who needs to be in there. You may have the director of quality, but you may also have the CFO because he wants to see everything, he or she wants to see everything happening underneath. You may have 3 IT analysts. And this is not a group that necessarily can have honest and frank conversations. But then the other thing is that they may not have a shared purpose. You may have charted this to say, yeah, we need a data governance group. What do they do? Well, we don't know what average length of stay is defined for the group, so we'll make that our agenda item. Well, it doesn't work as well. I just in general, governance cut from the cloud and landed on Earth doesn't really help. We found the best way to get governance really going is to actually start it as program leadership for the projects that come out of that 12-week assessment process. So not everybody may understand governance, but they do understand projects. So by wrapping governance decisions in a project framework, you lead your team into the practice of governance. And you learn by doing with relevant examples. You'll get to your average length of stay, but it's going to be organic and it'll be at the right level. And it'll be related to a specific point in the projects that you're chartering. So steering, people get how to steer, people get how to manage a project, but you need to give them that framework. Otherwise, you just can't have them come down from Mount Olympus. In designing how the governance group is structured and how it works, we've put together sort of a 3-level governance design. And what we think that you have your executive leadership for leadership and approval. This is the group you expect to set the direction, be the tiebreakers in the enforcement of the data standards and goals. And in general, this is most successful when you piggyback it or add it as an agenda item on existing executive team meetings. Next is analytic leadership. So these are the data experts. They're working together on the data definitions, the standards, and the deliveries. And they're matrixed from existing teams. This is where your data stewards can come out. And this is the team led by the emerging role of the Chief Analytics Officer. And then finally, you have a problem solver team, and that's a partnership of analyst level and business owners to get a single goal, and that is workflow improvement, patient care enhancement, what if. It's chartered an executive direction, and it enables organizational initiatives. So that's analysis in action. I put together a visual that shows how these teams lock together. So again, leadership and approvals across the top, aligned by organizational responsibility. You can have that chief data officer or that chief analytics officer in that red box on the executive leadership piece. The second piece is knowledge and standards, the analytic leadership. You have finance, you have ambulatory, patient access, quality is in there. The leader of that group sits with executive leadership. The participants of this group then also go down and become part of analysis and action, and they become the project doers of problem-solving team for analysis and action. This visual really helps lay out how you can put together governance. Now, in general, what you would say then is the middle level is your data governance team. It can be a matrix group of analysts. You bring the right people in, but you don't bore a CFO. You don't take a director of quality and make them lead that. You need to have your BI or analytics lead be the leader of that middle level. That's where all the heavy lifting is going to be done. Let me talk a little bit about assessing tool sets. So we talked about governance. We've talked about how to structure a project to get you through here. We've talked a little bit about how to align things with mindset, skill set, and tool set. I did promise that I would talk a little bit about tool sets, and so that's where I'd like to be. So let's talk about that. The current BI tool set landscape can be very confusing. So here are the basic questions you need to find out. What are you selling is the first thing. We need to find out if it's a presentation layer or a complete analytics solution. Now, when I talk about complete analytics solution, I call that a shrink wrap solution because that means it's more or less ready to take off the shelf and start using. I'm going to get into what these details mean in just in the next page. If it's a presentation layer, what else do I need to make this work? Is my EMR, billing, claims, and quality data accessible? That's something you need to work with IT. If it's a shrink wrap solution, what's your hosting model? What's the core data the system is based around? And what are the currently available subject areas? So I just went deep on this. I'm going to actually back it up a little bit and explain what I mean by each one of these points. So a presentation tool set runs on top of data. These are the tools that like ClickView, Tableau, SAP Business Objects in Crystal, Cognos, and there's a number of others. The onus is on your team to maintain the underlying data structures and point these tools at your data. It can be a little confusing between these tools and a shrink wrap solution because some of these tools have partnered to create quick start templates, but ultimately they are tools that run against a database that you're maintaining for separately. So for instance, Business Objects, they build universes against Siemens DSS. They build universes against Epic Clarity. Tableau has partnered with, I believe, Cerner and Seattle Children's to have some quick start templates to offer analytics directly against the Cerner data models. But when you're buying Tableau, when you're buying SAP, you're buying a reporting tool set that requires maintenance of an underlying database. The other thing to remember about presentation tool sets is that some of them you may already have in-house are tethered solutions. So for instance, you may have a version of ClickView that was bundled with your surgery system. That's tethered to the surgery system. It can't be used against other data sources without expanding your licensure. So then let me go over to, it's not a bad thing. You can buy more. It's not an issue. But what we've run into more than once is a situation where they lay out and they say, well, we've got business objects, we've got ClickView, we've got Tableau, and we've got Crimson, and we've got, like, they lay out about 8 tools, and it turns out that 4 of those tools are limited use licenses that are running only against one of the ancillary systems. So it's not as though they had those as BI tools. It's rather that they're tools that they have that they have access to, but it's not. It doesn't move the needle for them on their BI tool sets. Sorry, that was rambling. Shrink wrap data warehouses. They take the data out of your systems and then they load it into their data model. So that's where we talk about Crimson, Humedica Optum, Verisk, IBM Premier, Catalyst, Explorus, Healthcare DataWorks. They have services and expertise to map your data to their model, and that offers high value. There's short time frame. The key stage is to make your data look like they expect it. That's your big challenge. It'll expose issues in your data, non-standard use of data files, data hidden in your text fields, but that's the main difference. And to be fair, these tools may also require that you license a presentation tool set. For instance, if you go with a Catalyst solution, they provide a great data model. They provide the data warehouse expertise, the load models, and data marts, but you would still need to contract and get yourself a copy of ClickView. So just want to have that out there. Let me talk a little bit more about shrink wrap. Some of the other things you need to talk about is whether or not it's software as a service or it's site hosted. Are you shipping your data to them, or is their data model implemented in your systems? So software as a service is the dominant model right now. It allows for anonymized aggregation across their client base. So when Crimson or Explorus are talking about doing comparisons against their other customers for you to use in your population health analytics, it's because they're hosting all the data and they're able to run anonymized queries and get that out there. Now, site hosted means that your team's in charge of supporting it. It's kind of we teach you how to fish and you support it, but we at least jumpstart you with a great data model. IBM's got that data model. Catalyst does that. Recombinant does that. But you get the flexibility to extend that data model, and usually you get great performance because it's all happening behind your firewall as well. I want to talk a little bit about data type and latency. This is the final piece that gets people tripped up when they're evaluating third-party tool sets. The first piece is, there are strong statistical models that are based around claims. This is the model where payers have been using this to evaluate provider performance. Now we have access to similar tools to evaluate our own performance before we get dinged by them. Adjudicated claims have great metrics, but they have high latency. They have to make their way all the way through your payer's digestive system. Finance and contracting loves this data. Clinicians don't love it as much simply because it's old. The second type of data you might be dealing with is coded billing data from your AR systems. That could be nightly to monthly. And TrendStar, EPSI, Horizon Performance Manager, and Crimson are all based around that data. That's, again, great, but there's the third level, and that is the EMR feed where you're getting near real time, and that's actual lab values. Not just that they had a HbA1c lab test ordered, which may identify them as a diabetic, but rather what the actual value was. And I'm sure I just mucked that up. But many vendors are claiming to be able to use this, but only few really have meaningful metrics that piggyback off of claims integrated with coded billing data, integrated with EMR feeds. So I want to talk a little bit about the pros and cons of shrink wrap, simply because I feel as though there's a major decision and there's so much hubbub, especially if you go to HIMSS or any of these workshops, about the fact that you can contract with somebody like Healthcare DataWorks or Catalyst or any of these, and they will help you solve your problem. They are bringing their expertise to the table. They are leveraging making you be successful. Whereas the more traditional model of we build it, we support it, we will we will make this be successful is it's frankly not as attractive to sell right now. So the overall pro and con on shrink wrap is the advantage you have is that there's a library of models they're bringing to the table. They've got pre-written queries ready to run against the database. They've got multiple attribution models usually. They have disease cohort identification, not just through the diagnosis codes, but they've got lab values and medications that the patient might be on. They've got comparisons of peers, might be other customers. They've got benchmarks and national and regional averages. They've got a fast time to implement usually. The biggest disadvantage to a shrink wrap solution is when your practice doesn't conform to what they expect. So there was one vendor who had a comparative metric for readmission that they were publishing out. They had to pull it when they realized that they weren't doing it right the right way for pediatrics. Pediatrics does this is going micro, but sometimes they do a discharge to home process to allow kids, sick kids, to spend the weekends at home. It's not as though they've been fully discharged and are being readmitted. It's really more of a transfer to home bed. But in the readmission model that was provided by this vendor, the pediatric institutions were showing as having nightmarishly bad readmit rates. Also, data in your specialty systems, your genomics, your cardiovascular, your RADONC, is often not in the core data model for any of these shrink wrap solutions, and you would need to build out solution. I'll just tell you right now, when you go and you get demos, everybody does find the diabetic well. It's real easy to get that now. But you need to make sure the tool goes against the data that you care the most about. So I'll go somewhat quickly through this using the framework, just determining the presentation versus shrink wrap, and a few extra details to just help you understand what you have, and then that helps you figure out where you need to go from here. So I have ClickWeave, the surgery system. What can I do with that? Well, it's a tethered presentation layer, so it's not going to be an ingredient in your larger BI strategy. Well, we got business objects with Epic. Sure, that's a presentation layer. I happen to know that that's an untethered solution. Epic doesn't do a VAR, so when you buy BO through Business Objects Crystal, you can use it for anything. We're starting to work with Explorers. Okay, that's a shrink wrap data warehouse. It's software as a service. They have an integrated presentation layer. And that's an EMR clinical and billing feed. That's just what you need to know what that is. We have EPSI for cost accounting. Well, that's a shrink wrap. It brings in EMR billing. It's typically a monthly feed. And typically you would pair that up with the business objects or Tableau. And then, our payer's offering us symmetry for analytics of our claims. Great. That's shrink wrap. It's an adjudicated claims-based analytics. You've got to remember 60 and 90-day latency. And it's only going to be useful for retrospective analytics. It's not going to really do you much for bed turnaround times last week. I have a final word, if you can believe that. Final word on tool sets. And that is, just in general, even though you can tell I have a passion for tool sets, it has to be, we need to change the old, if we build it, they will come mentality. BI toolsets demo beautifully, especially from the shrink wrap vendors. But it will be a wasted investment unless you have a clear purpose of how the organization will use them as an enterprise. You need to start with the transformation of mindset. You need to assess skill set as well. So once you've assessed mindset and skill set, then you can look at tool set. So I want to get into the skill set piece. If you don't have access or budget for good data scientists, people who are able to ask the next question, people who are able to read the research and decide to build a patient cohort based off of the latest way of identifying an emerging COPD person as opposed to simply looking at diagnosis codes. Report writers aren't necessarily that skill set. You need a creative skill set. You need an analytic skill set. So there's been a number of our customers who, largely in community hospitals, smaller markets, who are looking to shrink wrap vendors, not because they're mostly because they just can't build and support an enterprise data warehouse solution by themselves. So my quote, if you just walked away with one thing here, is that despite the fact that I just talked for 15 minutes about tool sets. New tool sets without major changes in mindset and alignment of skill sets is just IT wasting money. So let me just recap for a moment. My goals today were to speak about the expanded role of analytics in healthcare. I think we did that. We talked about the triple aim, and we talked about how there are new areas that we are expecting analytics to be addressing. I was going to talk about a framework for transforming your organization organized by the leadership mantra of mindset, skill set, and tool set. That we did go through that. We talked about how skill set, how mindset it involves organizational leadership. It involves enterprise governance, and it involves value realization. We want to make sure the skill set involves making sure that you have the right skills on both your IT group as well as the change leadership abilities on the clinical side. And then tool set, we do want to make sure that you're assessing and evaluating the tools for analytics as well as for data transformation. We were going to talk about how to structure a project to assess your organization's analytic maturity. To do that, I explained our analytic maturity model and how to place yourself on that matrix. We talked about how you can structure a simple 12-week project to look at your own organization, assess yourself frankly and reasonably against that model, and then structure a group of projects to move yourself up one level on that matrix. You want to make sure that you don't try to do a moonshot. You want to just get one solid step up the rung. And then finally, penultimately, I want to talk about how to structure data governance for success. I gave you a 3-level model that you can use for conceiving of your data governance group, as well as a best practice of starting your data governance group by using it as project leadership for the projects that come out of your 12-week program. And then finally, we talked about some ways to assess the current landscape of analytics vendors. And hopefully I did that by helping you understand the difference between a presentation layer, the difference between some of the ways in which you should be looking at the new generation of shrink-wrap data warehouses, some of the pros and cons of moving forward with any of those, as well as a couple of details on a couple of vendors. It was never intended to be exhaustive, but rather just to talk. So hopefully I've succeeded to some degree. Should you want to dig in deeper, please do send a question. We've got time for that. And you can also contact me directly after this webinar. And with that, I would hand it over.
Thanks so much, Jim. That was really an excellent presentation. I want to congratulate you, first of all. So congratulations. That was excellent.
Thank you.
We do actually have a number of questions. I guess before we get to them, I would just like to ask you one from my standpoint. I think that one of the paradoxes of this, and this is something that we're coming across in our coverage in the magazine, is people are both too big picture and too small picture right now. And what I mean by that is, on the one hand, they're trying to boil the ocean in a lot of cases, and I know you really addressed that in a lot of ways in your presentation. And on the other hand, they're not setting up appropriate governance even to boil 1/1,000,000th of the ocean. Does that accord with what you're finding out there also?
Yes. Okay. So that as you're asking the question, I was thinking back to several of my clients where, viewed from the outside, they would appear to have they would appear to have a very, very well structured, mature analytics model. However, if you dig deeper into it, it's actually excellent in several silos. Where they succeed, or why I would say where areas. Let me put it to you this way: you can get ROI easiest off of individual projects. Where governance comes in and success comes in is in making sure that you're investing in tools that are not tied to an individual program, and governance that says this that says we as an organization understand and prioritize this particular project, and then we will do this project, and then we'll do this project. So I would never suggest that to get to transformed, you should be firing on all cylinders in every subject area. But where a transformed or a proficient organization really excels is in recognizing that we're going to attack this, we're going to approach this, we're going to approach this, and they're all in line. Where it's a fundamentally different way of looking at it from the way that they do it in foundational, where you have a genius CMIO sitting over on the side, and he's got a skunkworks of 3 people with ClickView grabbing data and publishing statistics that nobody else is taking a look at. The output may look the same, but the organization is behind one of them, and the other one is a rogue project. Did I make that sense?
Yes, absolutely. And I think that's where being strategic, creating good governance, that, as you said, as you pointed out, emerges organically out of project management. I think that makes sense. And I think that one of the things that happens is that people get that they're both trying to do too much and also not looking at the big picture at the same time. So, yeah, what you said makes sense. So we do have several questions, so I'm going to try to get to some of them. Let's start from the first one. Well, the first question, in a way you kind of answered, but I think I know what the questioner is getting at. The listener says, do you use the cloud to store the data? And in a way you address this in different ways, but if you could just briefly address that.
Sure. So again, that tends to be more of a solution based off of your tool set that you wind up living with. There are several shrink wrap tool set vendors who are using the cloud, and there are several who believe that you get better performance by hosting it locally. I would say that there's not consensus yet on whether or not the cloud has to be a part of this. I would say that the more you rely on comparative and integration of other people's data with your own, the more likely it is you want to have it be out there maintained by somebody else.
That makes a lot of sense. Jim, another listener asks, do you really think that a current data warehouse software can be the base for the future pictured in slide 8 and with the challenges listed on that slide 8? Any thoughts about what that software would be technology-wise? And I'm not sure.
Let me I just brought up slide 8 there, right?
Yeah.
Okay. You know what? That's more of a logical picture than I honestly have come around to the idea. I used to be you've seen my resume. You know that I was doing data warehouses in the 90s, and I was a huge believer in the build a beautiful warehouse. I have grown to believe that it is okay to have a lot of federated marts as long as you try your best to conform the dimensions. I believe that I now believe that for performance purposes and as well as specialty of data, it's okay to have 6 or 7 different products. The key is to make sure that you have governance and that you get into each one of them with intention. You simply don't want to have it be that the CMIO or the CMO goes out and buys Crimson or gets a physician dashboarding out of Premier without everybody being in line saying, okay, great, then that's where we're going to get our data out of. Because that's what I keep running into is that the docs have a Premier scorecard, IT has something out of Cerner, and quality has something out of Midas, and they don't match. And that's where you have to have your data governance with a lowercase g to make sure that we all agree. But then the reason that they all did that is that they didn't have a forum to say, we need this information, we're going to buy this tool, but this is how it's going to fit into the overall picture.
Right. I understand. Let me try to get in at least two more questions.
Yep.
We have about 5 minutes. One listener asks, won't enterprise-wide information systems be a better, faster architecture to support advanced analytics compared to best-of-breed information systems in which data must be acquired by interface and taxonomy, and terminology may vary across each system?
Well, no, I mean, in terms of best practice, if you have access to a strong enterprise warehouse and you already have it built, or if you're a vendor, for instance, I know that Epic customers have about 90% of their key information usually resides in Clarity and now in their Epic Data Warehouse product. Yes, that should work fairly well. However, I only speak to this because I've seen many sites in which the perfect is the enemy of the good. And they at one site I was at, they had spent 3 years. They were deep in, elbow deep on an enterprise data warehouse project, and they finally wound up pulling the plug after about $20 million invested, and they wound up moving to a federated data mart model. And almost all of the key users were happier, and they were able to get things done in 6 months. So I can't argue with the beauty of a solid enterprise data warehouse that is built this way. It's great. I just feel as though a lot of times you need to go the other way.
I understand. We have time for two more questions. I'll try to ask them very quickly. One is short. Under a software as a service model, where is the data stored?
It depends on the vendor. Some of them actually will, like for instance, Healthcare DataWorks, provide an appliance that sits behind your firewall, and they maintain it, and you get good performance off that. They also have data center hosted ones. I believe Catalyst works a similar way that you would host it yourself, but they would maintain a lot of it for you. Other ones, the data is in their cloud, Explorers, Crimson, Premier. It's out there, and so that's why I had when you're talking about software as a service, that kind of site hosted versus external is a key differentiator to ask them about.
Good. We have time for one more question. What are the challenges encountered when doing analytics implementation / execution for a transformed state?
Well, okay. The challenge, having worked for, and I'll be completely honest, I've worked for one transformed organization. Okay, there aren't that many.
Yeah.
One of the things you run into is once they're transformed, they are very good at the things they do and the things that they have architected to do. They can become ossified. It can be difficult in a transformed organization that the analytics becomes so much of a service that it's almost hard to get them to look at a new way of doing things. It's almost it's the problem we've run into in data warehousing forever, is that the data warehouse can become a reporting service, and once it's become a reporting service, you're stuck, and then people try to do end runs around. So I'd say that's the biggest problem that you run into in those, is simply there becomes an orthodoxy, there becomes an ossification of process. They know that they're good at this, and it gets hard for them to think in a completely different manner.
I think that's a great response and very thoughtful, Jim. I think it's a challenge that a lot of CIOs are facing right now. They want to provide all the data that everyone needs, but they don't want it to become commoditized, is one problem. And they don't want to lose the process context, I think, nor do other leaders.
Right.
So, well, I just wanted to thank you so much, Jim. That's all the time we have for questions, and I want to thank you again for a really excellent presentation. You brought us a lot of knowledge, wisdom, and insight here today, so thank you. And I'd also like to make sure to thank our sponsor, StarLIMS, for making today's program possible. Finally, I'd like to thank all of you in our audience for participating today. We do hope you'll join us in the future for another Healthcare Informatics webinar. Have a great day. This concludes today's presentation.